All right, Kuwait, you know that on a weekly basis, we do have a very special interview along with part of our collaboration with ضمان. So for today, we have a very special guest. Please welcome with me over the phone right now my guest for today, Dr. Nivin Youssef, Family Medicine Specialist. Good morning to you, Doctor, and welcome to the Breakfast Show on the Superstation.
Good morning. Good morning.
Thank you very much for giving us some of your time, and we really appreciate that. We've been looking forward for this interview since the beginning of this week.
Thank you.
Thank you, Doctor. I would like to ask you today, we'll be talking about pre-diabetes and screening and things that related to that. So I would like to start my question with you that they always talk about dates and how they affect the blood sugar and how if the people should stop them if they are pre-diabetic or not.
Dates. Of course, we all like dates and we all eat a lot of dates.
Yes.
We know how dates affect the blood sugar. But we cannot say that don't eat dates. It just decreases the amount. So if you're taking like 6 pieces of dates at the afternoon time, make it 3 and so on.
Okay,
so we just need to decrease it.
Okay, so decreasing the number and also to be rational in the consumption of dates is very important for the people who are pre-diabetic. Is that correct?
Yeah. It affects the blood sugar. So if you find yourself a pre-diabetic, you have to take care.
And if you are in the pre-diabetic phase, is it possible to prevent diabetes?
We cannot completely prevent diabetes, but they found out that the people that are having pre-diabetes, only 50% of them will develop into diabetes. How we are going to delay it or stop it, this is the most important.
All right. And also I would like to ask you, Doctor, especially for those who probably don't know if they are pre-diabetic or not, at what age they should start to be concerned about that? Like in what age they should start doing the screening? And also, what are the symptoms in your body that can tell you that you might be pre-diabetic?
Okay, so I think the age of 45 is the best age to start screening for diabetes. But in some conditions, when the person is obese and he's having a strong family history, I mean, many of his family is having diabetes, it's better to start at 40 years of age. About the symptoms, sometimes they will go with no symptoms. That's why we are asking them to screen for it. So sometimes there are no symptoms at all. But in some conditions, he may have fatigue, tiredness, okay? He may have a lot of thirst and hunger for no reason. Frequent needs to pass urine to go to the bathroom. He may have delayed healing of his wounds. Okay, so if he has a wound, it will not heal easily. So this will let him think that there may be something wrong. Also, in some conditions for female, they may have repeated candidiasis and itching at the private areas. I think these are the most important symptoms that may let you think about pre-diabetes.
People who are pre-diabetic, definitely they need to change their lifestyle, their eating habits, and a lot of things as well. Now, if they will actually start to do the screening at the age of 40, it's probably going to be a little bit hard to adjust into this new kind of lifestyle, especially by cutting down their intake of, I believe, sugar and sweet or anything that might put them in a very bad or dangerous situation to pre-diabetics. Now, do you have any kind of tips, Doctor, that can help people adjust easily to this new lifestyle?
Okay, the first thing is the physical activity. You need to do some sports or at least walk for half an hour daily for 5 days a week. These are the least physical activity you can do. So you need to walk, at least walk. If you cannot do any other physical activities, just walk. This will help you to adjust your blood sugar. Another tip is the healthy food. Make most of your food healthy. Don't go to the junk food. Don't go to a lot of sweets. If you are really eager to sweet, the fruits are better. So go to the fruits better than taking sweets. You know how the piece of baklava, how many calories does it have? The small piece of baklava.
How many calories?
A lot of calories, actually.
Oh, yeah. All right.
So it's better to go for fruits if you want to take something sweet.
Yeah. I really agree with you on that, doctor. Unfortunately, the education about food is very important, and we don't find it in a lot of places. As you just mentioned, the example of baklava, maybe a lot of people think that a small piece of baklava probably have little calories. They don't know that the small piece of baklava might have can be actually very high in calorie, depending on the ingredient and the sweeteners and the sugar that have been added into that as well. So food education is very important, I believe.
Yeah, and something that is happening a lot among youth now, the smoking and the shisha.
Yeah.
They are really dangerous for the blood sugar. They may affect your blood sugar. If you are prone to have diabetes, they will affect it badly. So stop smoking if you are smoking, and stop the shisha because it's more worse than smoking even.
Thank you very much, doctor, of course, for the information and for the valuable tips as well. Any last words you would like to tell the listeners right now?
I'd like to mention about the hemoglobin A1c, because a lot of people are asking, what is hemoglobin A1c?
Please.
It is the hemoglobin. It is the sugar that have been in your body for the last 3 months. So if you find it between 5.7 to 6.4, this is pre-diabetes. So take care.
Thank you very much, doctor, for this information. Yes.
Okay.
Thank you very much. Have a nice day.
Thank you for inviting me today.
Of course. Always a pleasure to have you on the phone, and have a nice day.